Now at 5:30, a CBS 4 News health alert, a new cause for concern. An illness affecting children that the CDC says is linked to COVID-19 has been confirmed at 2 Miami-Dade children's hospitals. Both Holtz and Nicholas Children's Hospital say they now have patients receiving treatment for multi-system inflammatory syndrome. CBS 4's Steve Goldstein joins us live in the newsroom with the warning for parents tonight. Steve.
Well, Francis, developing situation, those 4 confirmed cases in South Florida, 2 children in pediatric ICU at Holtz Children's Hospital in Miami. Now, the good news there, they're showing signs of improvement. And there are 2 cases as well as Nicholas Children's Hospital. So what exactly are we dealing with? Multi-system inflammatory syndrome, or MIS-C, is thought to begin weeks after a child is exposed to COVID-19, and it's a reaction to having had the virus. Many children tested positive for coronavirus after the syndrome was detected. I spoke to Dr. Aileen Marty, infectious disease specialist at FIU, and asked her what parents should look for.
So what they're going to find is that their children have maybe a tummy ache, maybe some vomiting, some nausea. Those sorts of things tend to be the first things that children present with. And then you have to monitor that child and see if their blood pressure starts to go down, if they get tired, if their joints ache, if they have swelling of the hands.
The syndrome sets in when blood vessels get inflamed. Now, the big problem occurs when the heart's blood vessels get infected. Then the disease can be deadly. As
we know, some children have died because of this weird immunologic reaction.
There are cases across Europe and reportedly in 18 states in the U.S. and Washington, D.C. Dr. Marty worked with cases of Kawasaki disease 3 decades ago. In many ways, it mirrors what she's seeing now. These cases are no surprise to her.
To be very honest with you, I wasn't surprised that we started seeing cases of this in children that had had COVID. I was more surprised that it took so long for people to start realizing it was happening. It's a bad reaction to having had an infection that happens in some children. And it's a small percentage of the children that get infected. But because we are seeing millions of people infected worldwide, some of those people are children, and some of those small percentage that are children will end up with this problem.
Let's keep in mind the majority of the time kids show mild symptoms like fever and coughing. In the newsroom, Steve Goldstein, CBS 4 News.